Kate is the Assistant Deputy Minister from the Health Promotion Division at the Ministry of Health and Long-Term Care. And Kate is going to do some welcoming remarks. And she also thought we should know that she has 2 small children and thinks that she talks about health promotion a little too much. Come on up, Kate.
Well, that was extremely fun and an extremely hard act to follow. You put the fun ladies in charge of the enthusiasm, followed by the boring representative of the government. But that's me. I was so pleased to be asked to open your conference today and give some welcoming remarks. It's a great honor to be with you here today. I was saying to Barb from Health Nexus that I always learn so much when I have the opportunity to meet with people who are working on health promotion at the community level across Ontario. So thank you so much for being here today. I wanted to welcome you officially to your 2013 HealthLink Conference, Linking for Healthy Communities, Collaborating for Change. What a great theme for a conference. I'd also like to thank the co-chairs, the staff at HC Link, and all of the speakers and presenters today for contributing to this very important event that's brought together so many people that work in support of health promotion in Ontario. I would also just like to introduce one of my colleagues. I think there are a few people from the Ministry of Health who are going to be joining you to listen today. But Colleen, do you want to jump up and say that's me? Colleen Keel is one of the managers in the Health Promotion Division. And also Laura Pisco, who's our Director of Health Promotion Implementation, will be here at different parts of the conference. And as Andrea was saying, I hope to be able to return for some of the sessions over the course of the next 2 days. Very exciting to be here and to get to meet people from so many different sectors that Andrea was pointing out. I'm going to start with recreation, municipalities, public health, social services, healthcare, and several more I'm sure that I've missed. And I'd also like to welcome those of you that are joining along today by live stream. So your conference theme, Creating Community Change by Engaging Communities, Working in Partnership, and Fostering Environments and Conditions that Support Health, aligns so well with the priorities that the government has established for healthcare. You may be aware that going back to January of 2013, the Minister of Health, Deb Matthews, introduced the Action Plan to Transform Healthcare for Ontario. And the first pillar of that plan is keeping people healthy. And it's the pillar that obviously we in the Health Promotion Division work on. And we're so pleased to be working on that with all of those in the room here today and your colleagues as well. And I thought if you would permit me, I would talk just for a minute about one of the priorities that we're working on under that broader umbrella of keeping people healthy. Because so much of the work that you do is so contributes so significantly to that. So I thought I'd give you a bit of an update of the work we're doing on the development of a childhood obesity strategy, which we're calling the Healthy Kids Strategy. So you may recall that going back to last year, the government brought together an expert panel called the Healthy Kids Panel. And in March of this year, they released their report to government, which was called No Time to Wait. And the reason behind that title was, as you can imagine, the understanding that this is a problem that really requires action on a really urgent basis to help kids in Ontario to have healthier weights. So over the course of the last couple of, I guess since about September, so it's really only been about 2 months, the government has begun to announce initiatives that are going to articulate our strategy for healthy kids. The strategy is going to have 3 parts. Healthy Start, which focuses on preconception, prenatal, and early years development, healthy food, and the third, healthy active communities. So with respect to the first of those priorities, Healthy Start, going back to September, the government announced some new investments to help moms who want to breastfeed to have better support to help them be successful in breastfeeding. Because we know that breastfeeding contributes so importantly to healthy human development, and it's also a really important protective factor against overweight and obesity for kids. The second pillar of the strategy, healthy food, is obviously something that's near and dear to many of our hearts here in this room today. The government's announced 2 things with respect to healthy food so far. The first is an